2021. I'm still with the Wilson Socioeconomic, SG and nominated Member of Parliament, Tony Watima, Independent Economist, Dr. Andrew Were, President of the Kenya Medical Association, Dr. James Nyikal, Member of Parliament, SEME and Member Health Committee. And Dr. Were, before you move on to the next topic, I would want you to clarify, because you said that the borders are some of our points of danger because of the infections that are coming from those areas, including the strains or the variants. How would you make a case for that at a time that when you look at the numbers, you don't see alarming infections at the points of entry, you don't see very high infections at the border counties?
Thank you, Sam. I think what we need to ask ourselves, what are we relying on the test results that we're getting from our counterparts in Tanzania, or are we doing our own testing at our border? Because that will help us actually know the real situation at our border points. And we need to look at all border points from Isebania, Namanga, Taita Taveta, Lungalunga, because all these are entry points. And if we do not continue doing proper surveillance at those points of entry, when we know very well that our neighboring country does not have any measures towards addressing the pandemic in their country, then I'll be very hard-pressed to believe that we only had 2 truck drivers turning positive in Namanga.
Well, yeah, of course, we'll continue to monitor the situation. Dr. James Nyikal, are you convinced that the border points are a source of threat and more action needs to be taken at the regional level, as suggested by Honorable Socioeconomic?
Definitely, the border points are important. I mean, we are, first of all, closing certain parts of our country because of movement of people. The same principle must apply at the border points. Unfortunately, we probably may not have as much control. But really, there are international health regulations that countries are supposed to adhere to, and also the international reporting, so that if we are not getting data immediately at the border point, we should actually get reporting data from WHO, which we can get. But it's extremely important that we know what is happening and we regulate movement of people at the border, and we do serious surveillance at the border, so that testing, the integrity of testing is everything in the control of this or any other pandemic, particularly at entry points. So that point is extremely important. Whatever containments we do here, if we miss that one, we have a problem. I mean, if we had an integrated East African community, as we had in the earlier days, long before independence, long ago, then it would have been easy, because that time there were a lot of common services that were actually carried out together. But now we are moving in that direction, but this is an indication of the need for integration, harmonization within the community, the East African community, and surveillance that is harmonious and combined and agreed to on both sides. So if we're getting our figures on this side of the border, really, we needed to know what is happening that side of the border. So the border points control and surveillance are also critical in the control of the pandemic.
Okay, all right. And Tony, as you see the images on the, what side of the screen is that? The left side of the screen, now on full screen. The vaccination going on, they're starting off with events of at State House on Friday, the President and the First Lady getting the jab alongside senior government officials, including cabinet secretaries. And you've seen some of the stories on the 2 dailies, including the Standard talking of people who've gone through the vaccine and telling their story. There's a clamor by the Kenya Tourism Federation to be added to the priority list. These they have described this as a limited resource, because so far just 1.2 million doses in the country. I don't know whether that should take care of 1.2 million people or 600,000 people, bearing in mind that you have to get a double dose. What is your thinking about looking at key economic areas vis-a-vis the vaccination to protect those people that work in those institutions, but also to protect the livelihoods?
Okay. Before I answer that, maybe if I say something before we move from that,
all right,
about what Dr. James Nikal was speaking about, and I think Socio. In the East African region, we agreed on a harmonized program in terms of movement of goods, and that was agreed by all member states. In terms of facilitation of movements across borders. And that includes surveillance and control measures, but it's specifically on truck drivers that are main people that we agreed on who will be in the serious surveillance on that system. So basically, what the system is, and it's a harmonized system. It's one system that was developed, and so if you're leaving Mombasa with your truck, you're able to test in Mombasa. You feed in your system, and then you tested in the border of Malaba. Previously, you'll have a 2-day test. You test 2 days before you start your journey, and so it created a lot of delays in terms of waiting for your results, and then you have a period. By the time you get to Mombasa, you also have another test and all that. So we redrafted that as the East African community about a harmonized system. So unless we're talking about maybe we scale up that and we have a broader surveillance system across borders, because this one works for truck drivers only. The other point is about vaccination. My take is different, and I think it's good that we have doctors around. The fact that Kenya, you look at what we acquired through the vaccination program and the rollout, you look at that program is not adequate enough, because we're talking about vaccinating 30% of the population at the year 2023. That is more than 2 years from now. That means we'll be having more waves and waves between that 2 periods. You need a herd immunity of around 70% in order to open you confidently open your economy completely and have a stable recovery. So we are talking about so many years in terms of that vaccination rollout. And so one of the problems we have is about procurement of those vaccines. And what we have today is not that government procured them. It's procured under the COVAX initiative, and an initiative about global vaccination access for developed countries. So it's led by African Union. Much of it was paid by the funders of the COVAX initiative. It's not by government. And so my question will be that, especially to Susion and Dr. James Nikal, who are the members of parliament, we haven't seen government allocating funds specifically for vaccination program, that we target a 70% immunity, herd immunity. That's the problem that we have. And even I come to your question about tourism sector, unless we have a proper mass vaccination program rollout, we will never talk about a stable recovery. We'll never talk about coming out of this pandemic. And even as the tourism board proposes, it's just a short-term measure that people who are tested and people who have antigens and all that can be able to move, because currently we have a contradiction that international tourists are able to move within domestic travels, but Kenyans cannot move. That's the irony. And the explanation is that the international tourists have been tested. But what happens to Kenyans who've been tested? They still cannot move. And so that's the contradiction and the irony. And so even if they propose that, it's only a short-term measure. And if that proposal goes through, it will be only another month or 2 or 3 months. And you also have another wave. And so the question is, what is government's outlook on how to contain this, and what's the period? Because we cannot be talking about 30% of the population vaccinated within 2023. I think we are losing the big picture, because we'll be left behind by the global world. You find that there are countries who vaccinated 45% of their population today. And us, we are not even at 1%. And so the question is, even if we talk about whatever control programs we have, I think mass vaccination is one of the biggest things, but we don't see that prioritized under the government plan, especially in terms of funding and financing for that program.
Right, and Honorable Sosion, of course, when you're to look at the question of vaccination, the reason why even the President and his cabinet decided to take up this exercise on Friday is because of the hesitancy, and people have been, should I say, quite hesitant to take it.
Very averse.
Yes, very averse. Have you taken the jab? And whatever that answer is, what do you think needs to be done at a time that all the vaccines that we have in the country are squarely donations?
Yes, I've taken the vaccine, and we've encouraged teachers all over the country to take the vaccine, and even those who will be coming to mark exams shall have taken the vaccine. And looking at our debates right from when the containment measures were put in place, March 2020, and our debates and conversation, well, that this disease will be well contained once a vaccine is discovered. Now we are not talking about lack of a vaccine. We are talking about various vaccines having been approved and being availed to populations or citizens. And for Kenya, I think we should not talk about the people being averse. It's very easy in this country to move a vaccine and to move an agenda until it's really accepted by the population. By and large, we've seen people take the vaccine very greatly. But I think, as has been stated by our economist here, I think we should now look at covering the entire population, so that, of course, these containment measures are temporary. They're so temporary. They are supposed to be temporary, and it doesn't offer a lasting solution. The real lasting solution is a massive vaccination rollout. And this now indicates the government, other than thinking about the containment measures, because we will not be rushing with containment measures at the advent of every wave, because now we don't know how many waves we will have in the course of the year, and how many times we'll roll out these containment measures, and how long these containment measures will take.
Sure.
Those are huge questions, because these containment measures indeed are very disruptive. And other economies are working out of it by massively vaccinating their populations. I think I can't agree more with the fact that government then should not rely on donations. If we are thinking about protecting and insulating the economy from any other adverse actions in future, then we must invest in the vaccines. And we should see massive resources directed at the vaccines and serious mobilization of vaccination of a huge percentage of the citizens, if not all the citizens. We've seen within a very short time, Joe Biden focused on this, and when he talks of 200 million vaccines being availed at the shortest opportunity for all the Americans, that means almost the entire population will be vaccinated. And that is a country that will have a promise of a stable economy. It will get out of the mess of COVID-19. And I think as a country we should focus on that. If we are able to vaccinate the entire population within a very short time, and of course the other experts in the world are putting at the end of 2022 as the likely time of really succeeding and rolling out the vaccine across the country. But then, as a country, we should not be controlled by events of external events and events of nature. We should have our decisive program, and that decisive program to vaccinate the population means allocating resources. This now is the business of the executive and government to put in place a strategic measure other than vaccinating the frontline officers, teachers, the police, the nurses, the doctors, and everyone else, and a few other frontline workers. Are we able to vaccinate the entire population? That now is a question. So that then, in case of any wave anywhere around the world, as a country, we will be safe, And will be able to move about our businesses freely now that in-person learning is completely suspended? How are we going to resume?
Okay.
We can only resume through the route of vaccine by ensuring that.
And Honorable Sosion, I'm
vaccination
looking at the statistics, and the US appears to have vaccinated 130 million people so far. And of course, this has been rolled out since the new president came into office, which was in January. So in about 2 to 3 months, that has been able to be achieved. But Dr. Andrew Were, so we know that there's this conversation, and you've seen the statement from government that, sorry, Honorable Sosion and Tony, you can be heard. We've seen the government giving a direction that all persons that are above 58 years of age are now on the priority list. We've seen the teachers, the healthcare workers, and the people in the security organs, they are part of the priority list to be vaccinated. Again, 1.2 million vaccines or doses so far have gotten into the country. But I was looking at some figures here that will tell you that the disease burden is actually higher in the ages below 58, because from the statistics we have is that people between 20 and 39 account for 49% of the infections. 40 to 49, that is the ages of 40 to 49, account for 19%. So if you are to combine that, 49 and 19 should give you 68%. That is nearly 70% of people that are below the age of 50 years. But you're vaccinating above 58 and the others in the priority list. What is the bigger or the larger thinking to ensure that you're able, yes, to protect the most vulnerable, but also where the disease now is targeting, and there's no longer that conversation that if you're younger, you're not getting severe disease. We've seen younger people succumbing to the virus.
Yes, actually the decision by the Ministry of Health to vaccinate the above 58 years old was informed by the recent data that we have in terms of the mortalities that you're getting in this third wave. When you find more than 60% of the affected population is actually above 58. And that is what informed the Ministry of Health to actually have what we're now calling an accelerated phase 2, where now the individuals or the group of population that was supposed to be vaccinated in phase 2 now was brought forward and included in the phase 1, where we are dealing with frontline healthcare workers, teachers, nurses, and the security personnel. So in terms of bringing in more vaccines, we are aware that the government is now moving forward to partner with the private sector so that we can have large numbers of vaccines coming into the country so that we can vaccinate as many people as possible within the shortest time possible. What we need to understand, the issue of vaccine nationalization has been a big problem in terms of us getting the vaccine into the country, where we've seen the hoarding of the vaccines by the country, Western countries. And it's about time as a country that we also now invest heavily in our manufacturing capability. In the same way like India and now South Africa is going to manufacture their own vaccine, that we also have our manufacturing capability scaled up so that you can have these doses manufactured here in Kenya. So I know with the private sector coming in, with good controls in place to avoid the commercialization of these vaccines, then we'll be able to actually move together as a country and have as many vaccines available in the market so that you can reach this herd immunity as a definitive way of controlling this pandemic. Right,
and Dr. Nyikal, you sit in the Health Committee, and I believe I saw you in that tour of the Health Committee to Kitengela to see the site where the vaccines are being stored. But first of all, from your experience there, what is your impression? And secondly, do we know the shelf life of these vaccines? Do you know when they are expected to expire?
Yes, we visited the vaccine center in Kitengela, and from what I saw there, really we have the capacity. What we are utilizing now is about 30% of the capacity of that area. I think we shouldn't be really worried about the half-life or the shelf life of this, because what we really need to do is to move the vaccine very fast as soon as they come, because we don't have enough. So as soon as they come in, they should actually be moved out, and we get a program that vaccinates people, so that we don't worry about how long they're staying there. We should not go for a huge storage while people are not being vaccinated. But the capacity and the cold chain system that we saw is actually adequate. What is important is the issue of hesitancy that was there. I think that was lack of sensitization when the vaccines came in. And also there's a lot of information in the social media that is not scientific, that has affected people. And I think we are getting to a stage now where people are convinced. I myself have taken the vaccine, and it is actually safe. I can tell you it is much safer to take that vaccine than to get into your car and drive to Kisumu in terms of risks. So I think that hesitancy should actually go. Now, the other thing we need about it is programming. You want vaccines, one, to prevent severe illnesses that people get and the deaths that occur. And what is important about that is, apart from preventing death and suffering, we also will open up our health system if people don't get severe illness. And that is actually the reason why you want to protect people who are likely to get severe illness and go and clog up the health system. The health system may fail. Now in this town now, there's virtually no ICU beds that you can use. Now, good vaccination program, the first thing it will do is relieve us of that if there are no people with severe illness going into hospitals. And then, of course, reducing the transmission, and therefore being very important in control when we can get to the level of 60-70% of the population. Now, the programs we have really should be very systematic. The phases that have been put in place, but I think they should be followed strictly. And the distribution and the cold chain system, which is why we have actually, in my view, taken the AstraZeneca vaccine, because it is easier to keep in the cold chain system. It's okay, because what we had as a country for the under 5 immunization is exactly the same cold chain requirement that is needed for this vaccine. So I think to that extent, it's okay. The important thing that you've raised is funding.
Right.
I mean, the health committee, and actually we gave more money for COVID control, not just not specifically vaccines, and that is something we're looking at. And I would, and our committee would be ready, even if we had to have another supplementary budget, so that we put money for the vaccine. It always happens when we had HIV outbreak that a large number of the requirements were actually funded from outside. Even under 5 vaccination for a long time has been funded from outside. We must now get into the area, and we have been doing that in the health committee.
Right.
Vital requirements like vaccines, we should fund from within and give them priority. So in my view, it is important, a program is important, funding is important, and an implementation plan is important that rolls it out quickly. What we have now is still far from what we need. But let me add something. The private sector, when we come in, it will be very important that you have a clear policy guidelines on how the vaccines are used and how they're regulated. Already, this Sputnik came in, and we had this issue that the Pharmacy and Poisons Board and the ministry headquarters were not working. If that happens, we'll have a serious problem, because there are people who will want to cash in and even bring fake vaccines. So the policy, even if it's in the private sector, must be the same. The criteria must be the same. The regulations must be the same. If we don't do that, the problems in the private sector will actually disrupt the national program that must look at everybody.
But Dr.
That's also an important point that when the vaccines come in.
There's an answer I'm looking for. I don't know why you're not giving it to us, because you're the one who was there. When is the expiry of these vaccines? Because the uptake of this, as of Friday, we were told 90,000 had taken it, and we have a stock of 1.2 million from the reports we have. Should we be concerned?
We were actually told that the expiry, if in the best circumstances, will be 6 months, generally for the vaccine, not specifically what we have now. But my view is what we have is too little to expire. If it does, then the program we have is that we have not put a program of rolling it out adequately, because you see all sectors of the population are coming in and they want to be vaccinated. Hesitancy, I don't think is a big issue now. The big issue is the program to roll out. Where do I get the vaccine? And when you go to that center, who gets the vaccine? So that when people walk somewhere, they say, I'm in the right place, I get my vaccine and go.
Do we know?
Right now, the challenge we have, are we rolling out fast enough? 2, are we able to acquire through procurement of adequate vaccines without totally depending on the donations?
And Mheshimiwa, do we know the manufacturing date of these vaccines, the ones that you saw?
Yeah, we know the manufacturing date. I can't remember that specific factor, but I didn't get any fear that these vaccines may expire. My fear was that the coverage, the coverage and the program for using them is not adequate.
Okay, all right. And of course, we continue to pursue that conversation, because we saw some earlier reports earlier in the year in South Africa where the authorities there were asking for an exchange of the stock they had, or change of the expiry date, because they were afraid that the uptake was not going to be as fast as possible, and that would have been a loss in as far as reaching to as many people as possible. Let's now focus on what you see on your screen, economy and education, but specifically on the school calendar. Honorable Susion, we know that learning was disrupted in March of last year, up until the first week of October, when the candidate classes resumed learning. Then the entire classes have resumed in January 4th rather. And now, as some took a break so that the candidate classes can start the examination, then this announcement comes, including universities, the in-person learning will not be allowed. So what does this mean? Does it effectively close down the learning institutions, or what happens? And
temporarily, it does close down all learning institutions, except for examination classes. But our prayer is, this time round, it should not be prolonged. We should not have in-person learning in our learning institutions suspended for a long period of time. The net effects of prolonged closure was so devastating, and the damage on children, the losses, outweighs the reasons for closure. And many economists have struggled to put in restrictive measures without closing down schools. And I think this is the direction the country should take, even on the interim. And I want to treat it as the interim, the suspension of operation of schools and learning institutions. We hope it is going to be very brief because of the period of examinations. And we hope in the short period that institutions are closed down, government is going to reconfigure an approach so that the calendar that was designed towards end of last year and has been rolled out is not interrupted. Because if we go that direction, we are going to compound further the already ailing education system, the suffering of children. You have seen even students taking examinations, the number of girls who are delivering or are expectant and are taking examinations as an effect of it is now, our school system has changed.
Right.
Our management system has changed because children have come back with huge, huge challenges of effects of closure of schools, ranging from massive drug abuse to high numbers of pregnancies. It's not anything that we will be prepared to face again. So even in this interim closure...
Is there any good evidence that would warrant this closure that you're seeing in the institutions?
Well, I wouldn't say there's good evidence, but I would say this is a general interim measure taken by government to close down all institutions and restrict movements. And of course, schools and learning institutions are collaterals of this directive. But we are insisting and we are urging government to reconfigure and restructure and ensure that schools are exempted from this type of, from these measures within a very short time, so that learners can find their ways back to school. And we hope by that time all teachers shall have been vaccinated and other measures shall have been put in place so that in-person learning can go on. What many economies are doing, especially in the north, is even resumption of lockdowns, it's exempting schools, and schools are protected. So this time around, government must protect schools. And therefore, we hope the lockdowns that are affecting learning institutions is something that is being addressed now.
All right.
So that learning can resume immediately. We want to believe that by May 9th, the time that schools are, because now schools are on long holiday, other than the examination classes, by May 9th, all learners should be able to go back to school. We are not going to really imagine a situation of another prolonged stay at home. We will not be receiving children in school.
Right.
We will be receiving other forms of citizens who will have undergone very strange transformations, and it will be difficult to run schools.
Right.
We want schools to resume early enough this time round, considering the experience that we had last year and the lessons learned, the intervention measures that have been put in place, the vaccine coming in. Do we really have any justifiable reason to close down
I'm
schools
looking at,
for a long time? No.
I'm looking at the calendar and how it was impacted, because usually the academic year would begin in January and go all the way up to sometime in October when the national examinations would be administered. The second term, which began on the 4th of January, concluded 19th of March, that is 1 week ago, more than a week ago. Then the learners are supposed to be on holiday, like you say, until 9th of April, and that's about the time that the president says that they expect, or the government expects, the current situation to start flattening. The third term should begin on the 10th of May and go all the way until 16th of July 2021, after which the learners should take a short break and return for the first term of this 2021 academic year on the 26th of July. And I want to raise this with you, Tony, because yes, schools may be shut down, and they were shut in the 9 months between March and the end of last year. What sort of an impact does this have on the economy? Because we know some institutions, we had some teachers getting laid off, others going without pay, but globally, what impact does the education sector have on an economy?
Okay, let me start by answering it differently. I think one of the biggest concerns during this period of the pandemic is about education inequality access. And as we talk about in-person learning is not happening, we've heard last year that government saying online classes are going on. We don't have in Kenya access of online services to many households in Kenya. So basically you're making education an elite thing for a few people. And that's the tragedy about such kind of policies. The impact of education is very large. And one of the problems that we've had in this period of time is about private schools remaining afloat. And they feel a big gap in terms of education access. And so we saw quite a number of private schools went under because they didn't have resources, they didn't have sources of income to stay afloat. And so you find that the problem we end up with is that with those schools closed down, you have a bigger population of students coming to the public school. So you have an influx of new students coming into public school, and we don't have that capacity to handle everyone in the public schools. And so you end up with a situation where you have an access problem again, because not everyone who turns up in school, the school has capacity to accommodate them. And so that is a problem that we have. In terms of your question about the role of education, the role of education is paramount in development. It's not in the economy alone. It's about social and economic development of any country. It's one pillar, that and health. And so countries put a lot of money in education and health for prosperity, long-term prosperity in terms of economic development. And so we'll take a bigger hit globally in terms of that, because education has been an ailing sector during this period in time. And one of my concerns about education in Kenya is about, in Kenya, we have a good program under the education system that we have. We provide food for students. And if you look at malnutrition numbers and stunted growth in Kenya, it's one of the highest, especially even in the region. We are doing badly in terms of malnutrition. And so we've had this program for more than 30 years in terms of feeding program within schools. And it fills a bigger gap in terms of health issues for kids. And that has a long-term effect, because if you have a very healthy population of students coming into your new demography, I think you stand a better chance as an economy for better social economic development. So when we find ourselves in a pandemic, schools are shut down, such programs will not be happening, we create a problem that students are not enticed about education, because one of the enticing things and the incentive that was provided was a feeding program, which will not be happening. So I don't know what is being said in play, but right now, urban poverty will be rising highly. And so you find that kids within informal settlements will have such a problem in terms of feeding programs and food and all that. Right. Such programs should have remained in place on how do such kind of children get that kind of assistance.
Right.
Yes.
And Dr. Were, obviously, when you are to look at the numbers again, because statistics guide us on how we reason and the decisions that we make. If you are to look at the numbers, the segment between 0 to 10 years account for 4.18% of infections. For 11 to 19 years, it's 5.74%. So in total, between an infant and 19 years, that is 0 to 19 years, you're talking about 9.9%. Is this sufficient evidence so that when you're coming up with such containment measures as what has happened, that you say that suspend the in-person learning, was there any evidence showing that we're having infection being transmitted amongst learners and the teachers, whether it's in the universities or colleges or secondary schools or primary schools, and now warrant the taking of this decision?
Yeah, thank you, Sam. I think I'd like to echo the sentiments of Mheshimiwa in terms in terms of the issue of allowing schools actually to open, because we need to use the data that we have. If you look at schools that have been open in the last 2-3 months, and the number of fatalities or number of cases of illness reported, then they do not really warrant the in-person learning to be suspended. This is mainly at the primary and secondary school level, because it's a very small group, and they're not affected badly by the COVID infection. And now with the new drive to have teachers vaccinated, then I think we should actually allow in-person learning. For the universities and other higher institutions of learning, there is where I think we need to maintain the online learning. And the good thing is most of those institutions actually develop the capabilities to do that. So we need to use the data that we have, what has happened in the last term of school, how many schools were well prepared in terms of the hygiene, having clean water for sanitation, wearing masks, and how they did it, and then use that lesson to actually allow schools to continue learning, and also fast track and ensure that with the help of the Association for Teachers, that all teachers are quickly vaccinated.
And Dr. Nyikal, so what do we do? Because yes, there's that order suspending in-person learning until further notice. And this and next week, there's so many institutions that will be freeing their learners, because if they don't have that online capabilities, they'll have to let their learners go home. First of all, was it a good decision? And secondly, what happens before this can be reviewed? Because you've heard of announcements of reviews of some of the measures that were announced by the president.
I think it was definitely a good decision at the point where we are. What is important is how we follow up. And we have to take into consideration, why are we concerned about schools? And our people shouldn't take it that our worry is that the children will get sick or die. That is important. But what concerns us most is that the spread of the disease when you have large numbers of these young people. And when you get into the teenage group, then actually if they get the disease, the younger people, they don't get sick. But the spread, not only to the teachers, but even to their old parents, and generally the spread around. So that's an important factor to look at. But it's important really that during the time that we opened up, we really didn't get data. We are very bad with population data. Did we find out exactly the spread that came in, the transmission that came in? How important were the schools in contributing to this transmission? I don't think we have that data. We generally just think there was people moved around, and now we have more problems. But schools, we should look at. We can actually do population samples, even using rapid tests that may be cheaper, which may not just which will not tell you that this person is sick, but may tell you that over this period, these people were affected. So we'll have that data. So with the vaccination of teachers, with the vaccination of people above 58, so that the danger is less, we should be a little more relaxed in getting kids back to school, because it's not just the loss in the learning that is important, but how the kids are affected when they're at home. The delinquency problems that came, the problems with the girl child that came around. So it is one area we should look at very carefully, because we are closing schools to a large extent to protect the rest of the population. Therefore, we must look at how are the children themselves affected, long-term and immediate. So I agree that as we close down, we should carefully see that we don't close the schools for a very long time. Put these measures into place, vaccinate. If we could actually manage to get people over 50 or 58 all vaccinated, which of course is probably not a very easy thing to achieve, then we shouldn't worry very much with closing our children out of schools. That is one area, in my view, where if we had a good cover of all people at risk, particularly the older people, then we would be more relaxed with how we treat the schools.
Okay, all right. Thank you so much, Dr. James Nyikal, on that. I believe there appears to be some concession here. But as we come to the end of the show, unfortunately, we have to end it on a sad note, because we've just gotten news that Mama Sarah Obama has died. This is the grandmother of former U.S. President Barack Hussein Obama. And Mama Sarah Obama has been, of course, very well known in the public, and she's the third wife of the paternal grandfather of U.S. President Barack Obama, and she's known for she's known as Sarah Obama. And the reports you're getting now is that she has died at the age of about 98 years. And I don't know whether, Dr. Nyikali, you've had an opportunity to mingle with Dr. Sarah Obama. Your thoughts?
I actually had opportunity to meet her on one or two occasions during some programs that she was running while I was in the ministry. And she was actually a very active person. She was even involved in a lot of community work, and she carried herself with a lot of integrity, was more concerned about the community around her and how she could use the influence of President Obama and the access that it gave to her to actually further what is happening in her community. I think I remember when I was in the ministry, she was also even involved in the malaria control programs. I remember working with her and some of her people. So really, it's going to be a loss to us. And I can tell you, this is one reason why we are very careful on how we handle issue. I'm not saying that probably she was affected by the current pandemic, but we have to protect our older people, because we lose people who have a lot of experience, who are very focused as she was, and who are who are sensitive to community needs. I just pass my condolences to her and the people of Kogelo and the country at large, and the Obama family as a whole.
And I think it's just good manners to allow you, Dr. Were, as well, to pass your condolences on the passing on of Sarah Obama.
Yeah. So on behalf of the medical fraternity, Kenya Medical Association, we'd like actually to pass our heartfelt condolences to the late Mama Sarah Obama. And we hope that the programs she was running will be supported by the government so that the good work she was doing can continue beyond that. May she rest in peace. Asante.
Tony?
Okay, my condolences to the Obama family and friends and family of them and all the people affected during this pandemic.
Right, and Honorable Socioeconomic.
Yes, Sarah Obama indeed was a great matriarch whom we got to know upon the election of President Obama as the president of the U.S. And she displayed marvelous leadership skills. And I would say from the domain of teaching, she indeed was a great born teacher who did a lot to the society. And therefore we convey our condolence to the Obama family and the people of Kogelo and largely the people of CI.
Right. Of course, again, the sad news of the morning that Mama Sarah Obama has passed on at the age of 99. She was the grandmother of former U.S. President Barack Obama, being the third wife of the grandfather of Barack Obama. The reports you're getting is that the family has confirmed. We don't have further details, but as soon as we get them, we'll be sure to bring them to you. I also had an opportunity, actually, Honorable Socioeconomic, I had an opportunity to interact with Sarah Obama. I think it was in the year 2018 when Barack Obama was coming to Kogelo to launch that Sauti Kuu initiative by Obama's sister, that is Auma. And you have that warmth, this person that would welcome you, have a conversation with you in whatever language that she's able to understand. And so I can associate with some of the views that the panelists here have given. So condolences, our thoughts and prayers to the family of Mama Sarah Obama as they mourn their departed matriarch. Do you have some feedback to look at? Right, as we wind up on the conversation, you've been tweeting the show via Citizen TV as well as at Sam Gituku, the hashtag being Daybreak. Engineer Lazaro, you're saying that President Kenyatta got himself between a rock and a hard place, balancing between saving lives and a sick economy from total collapse. Authorities should give guidelines on how tenants should cooperate with their landlords at this time of partial lockdown. Then Calvin Mungai, you say the government of the flag of Kenya keeps doing the same mistake over and over. Close schools, then reopen. Borders, then open. What is to be expected? This is a failed state. That's Calvin who feels that. I don't know that we are to that extent. Jenga Wakungu, Tony Watima is very right. If we had a well-managed NHIF with prudent and uncorrupt managers, this COVID-19 would have been subdued long time. It would have been subsidized. The exorbitant cost of treating patients. What we have as a country is mismanagement. I don't know whether that reflects your views, Tony, but that's the feedback. Jacob Abere, you said that solution now is the government and world wishes to move in and offer reliefs to those who lost jobs from that evening, as we have seen religious institutions embracing online preaching. And lastly, they would have extended the days to relieve others to village. I bet you mean that it should have allowed time for people to go to the villages. That's the feedback that we have. Of course, so much of a social disruption that the religious institutions as of yesterday and moving forward in the 5 counties are not allowed to have in-person worship, but they can do other modes of worship. We'll continue to dissect what this impact is. Up next is Porty Monday. My name is Sam Gituku. Bye for now.